Hey friends, welcome to Nursing Online Education. In this video, we will be discussing important question and answers of different nursing comparative examinations. Guys, let's get started. Here is our first question.
1. During her 6th month of pregnancy, a woman visits the prenatal clinic for the first time. As part of the initial assessment, a CBC and a urinalysis are performed, which laboratory finding should alert the nurse that further assessment is required. A. WBC count of 9000/mm3, B. Hemoglobin level of 10g/dl, C. Urine specific gravity of 1.020, D. Glucose level of 1 in the urine. The answer is option B. Hemoglobin level of 10g/dl. 2. 4. Glucose level of 1 in the urine 95. 2 hours after an uneventful labor and birth, a client's uterus is 4 fingerbreadths above the umbilicus. After urinary catheterization, the fundus remains firm and 4 fingerbreadths above the umbilicus. What is the priority nursing action? A. Recheck the vital signs. B. Catheterize again in 1 hour. C. Notify the healthcare provider. D. Palpate the fundus every 2 hours. The answer is option C. Notify the healthcare provider. 3. A nurse is caring for a client who has had an open reduction internal fixation of a fractured hip. Which nursing assessment of the affected leg is most important after this surgery? A. Femoral pulse, B. Toes for mobility, C. Condition of the pin, D. Range of motion of the knee. The answer is option B. Toes for mobility. 4. A nurse is caring for a client with myxedema who has undergone abdominal surgery. What should the nurse consider when administering opioids to this client? A. Tolerance to the drug develops readily. B. 1/3 to 1/2 the usual dose should be prescribed. C. Opioids may interfere with the secretion of thyroid hormones. D. Sedation will have a paradoxical effect, causing hyperactivity. The answer is option B. 1/3 to 1/2 the usual dose should be prescribed. 5. A nurse is caring for a child with spasmodic croup. Which clinical finding alerts the nurse that immediate nursing intervention is required? A. Irritability, B. Hoarseness, C. Barking cough, D. Rapid respirations. The answer is option D. Rapid respirations. 6. What must the nurse emphasize to the family when preparing a child with persistent asthma for discharge? A. A cold, dry environment is desirable. B. Limits should not be placed on the child's behavior. C. The health problem is gone when symptoms subside. D. Medications must be continued even when asymptomatic. The answer is option D. Medications must be continued even when asymptomatic. 7. An older adult with dementia is admitted to a nursing home. The client is confused, agitated, and at times unaware of the presence of others. What is the best nursing approach to help this client adapt to the unit? A. Initiate a program of planned interaction. B. Explain the nature and routines of the unit. C. Explore in depth the reasons for the admission. D. Provide for the continuous presence of a staff member. The answer is option D. Provide for the continuous presence of a staff member. 8. The parents of a child with a fever, headache, and stiff neck express concern that the child be tested for meningitis. Which test should the nurse explain to the parents is used to confirm the diagnosis of meningitis? A. Myelogram, B. Blood culture, C. Lumbar puncture, D. Peripheral skin smear. The answer is option C. Lumbar puncture. 9. A nurse is caring for a client after a left pneumonectomy for cancer. The nurse palpates the client's trachea routinely. What is the rationale for this nursing intervention? A. A mediastinal shift may have occurred. B. Nodular lesions may demonstrate metastasis. C. Tracheal edema may lead to an obstructed airway. D. The cuff of the endotracheal tube may be overinflated. The answer is option A. A mediastinal shift may have occurred. 10. A CBC, urinalysis, and X-ray examination of the chest are ordered for a client before surgery. The client asks why these tests are done, which is the best reply by the nurse? A. Don't worry, these tests are routine. B. They are done to identify other health risks. C. They determine whether surgery will be safe. D. I don't know, your healthcare provider ordered them. The answer is option B. They are done to identify other health risks. 11. A client is scheduled for emergency abdominal surgery. What is the priority preoperative nursing objective when caring for this client? A. Recording accurate vital signs. B. Alleviating the client's anxiety. C. Teaching about early ambulation. D. Maintaining the client's nutritional status. The answer is option B, alleviating the client's anxiety. 12. An infant born with hydrocephalus is to be discharged after insertion of a ventriculoperitoneal shunt. Which common complication of this type of surgery should the nurse explain to the parents to prepare them for their child's discharge? A. Violent involuntary muscle contractions. B. Eyes with sclerae visible above the irises. C. Excessive fluid accumulation in the abdomen. D. Fever accompanied by decreased responsiveness. The answer is option D, fever accompanied by decreased responsiveness. 13. Parents are considering a bone marrow transplant for their child who has recurrent leukemia. The parents ask the nurse for clarification about the procedure. What is the best response by the nurse? A. It is rarely performed in children. B. The immune system must be destroyed before a transplant can take place. C. The hematopoietic stem cells are surgically implanted in the bone marrow. D. It is a simple procedure with little preparation needed, and the stem cells are infused as in a blood transfusion. The answer is option B. The immune system must be destroyed before a transplant can take place. 14. What is most important for a nurse to do when helping a new mother on the postpartum unit develop her parenting role? A. Teach her how to care for the infant. B. Provide time for her and her infant to be together. C. Respond to any questions she has about her infant's behavior. D. Demonstrate infant care and evaluate her return demonstration. The answer is option B. Provide time for her and her infant to be together.
15. When performing a newborn assessment after a vaginal birth, a nurse observes a swelling on one side of the top of the head. What clinical manifestation did the nurse identify?
A. Caput succedaneum that will spread across the scalp and then resolve. B. Fontanelle that bulges when the infant cries and will close in 18 months. C. Cephalohematoma that does not cross the suture line and will resolve in several weeks. D. Molding that results from the skull taking the shape of the vagina and will disappear in several days. The answer is option C. Cephalohematoma that does not cross the suture line and will resolve in several weeks. 16. Identify the auscultatory area. Questionable photo unde ad chayane. A. Mitral area. B. Tricuspid area. C. Pulmonary area. D. Aortic area. The answer is option A. Mitral area. 17. A 32-year-old woman presents to the clinic with complaints of palpitations, fatigue, and occasional chest discomfort. She has no significant past medical history. On auscultation, you hear a mid-systolic click followed by a late systolic murmur. What is the most likely diagnosis? A. Aortic stenosis. B. Mitral valve prolapse. C. Tricuspid regurgitation. D. Mitral stenosis. The answer is option B. Mitral valve prolapse. 17. A 32-year-old woman presents to the clinic with complaints of palpitations, fatigue, and occasional chest discomfort. She has no significant past medical history. On auscultation, you hear a mid-systolic click followed by a late systolic murmur. What is the most likely diagnosis? A. Aortic stenosis. B. Mitral valve prolapse. C. Tricuspid regurgitation. D. Mitral stenosis. The answer is option B. Mitral valve prolapse. 19. A 55-year-old woman presents with progressive shortness of breath, especially with exertion. On physical exam, she has a low-pitched, rumbling diastolic murmur best heard at the apex with the patient in the left lateral decubitus position. She also has a loud S1 sound. Which of the following is the most likely cause of her condition? A. Mitral stenosis. B. Aortic regurgitation. C. Tricuspid stenosis. D. Pulmonary regurgitation. The answer is option A. Mitral stenosis. 20. A 60-year-old male presents with complaints of fatigue and shortness of breath. On physical examination, there is a decrescendo diastolic murmur best heard at the left sternal border. The patient's blood pressure shows a wide pulse pressure. Which valvular abnormality is most likely present? A. Mitral regurgitation. B. Aortic regurgitation. C. Mitral stenosis. D. Tricuspid regurgitation. The answer is option B. Aortic regurgitation. 21. A 45-year-old man with a known history of mitral regurgitation presents with fever, weight loss, and night sweats over the past few weeks. On examination, a new regurgitant murmur is heard. Blood cultures are positive for Streptococcus viridans. What is the most likely diagnosis? A. Rheumatic heart disease. B. Aortic stenosis. C. Infective endocarditis. D. Pulmonary embolism. The answer is option C. Infective endocarditis. 22. A 62-year-old male presents with exertional dyspnea and palpitations. On physical exam, you note a high-pitched diastolic murmur and a bounding pulse. Which of the following physical exam findings is most likely present? A. Kussmaul's sign. B. Pulsus paradoxus. C. Corrigan's pulse. D. Pericardial knock. The answer is option C. Corrigan's pulse. 23. A 28-year-old woman presents with dyspnea and fatigue. On auscultation, there is a systolic ejection murmur best heard at the left upper sternal border, accompanied by a wide splitting of the second heart sound, S2. Which of the following is the most likely diagnosis? A. Mitral stenosis. B. Aortic stenosis. C. Pulmonary stenosis. D. Tricuspid stenosis. The answer is option C. Pulmonary stenosis. 24. A 58-year-old woman presents with shortness of breath and fatigue. Physical examination reveals a holosystolic murmur best heard at the apex, radiating to the axilla. Echocardiogram shows left atrial enlargement. Which of the following is the most likely cause of her condition? A. Aortic regurgitation. B. Mitral regurgitation. C. Tricuspid regurgitation. D. Pulmonary stenosis. The answer is option B. Mitral regurgitation. 25. A nurse is caring for a patient who just had a mitral valve replacement surgery. Which of the following is the most important to monitor in the immediate postoperative period? A. Urine output. B. Neurological status. C. Cardiac output. D. Wound drainage. The answer is option C. Cardiac output. 26. A patient who has undergone mechanical valve replacement is being discharged. Which of the following medications should the nurse expect the patient to be prescribed long-term? A. Clopidogrel. B. Aspirin. C. Warfarin. D. Heparin. The answer is option C. Warfarin. 27. The nurse is providing discharge instructions to a patient who has had a prosthetic heart valve replacement. Which of the following should be included in the teaching to reduce the risk of infective endocarditis? Limit physical activity for 6 months. B. You should take antibiotics before dental procedures. C. Avoid green leafy vegetables to prevent blood clots. D. Get routine flu vaccines to protect the heart. The answer is option B. You should take antibiotics before dental procedures. 28. A patient is recovering from aortic valve replacement surgery. The nurse knows to monitor for signs of which potential complication? A. Hyperkalemia. B. Cardiac tamponade. C. Pulmonary embolism. D. Pericarditis. The answer is option B. Cardiac tamponade. 29. A nurse is educating a patient post-valve replacement surgery about activity restrictions. Which of the following instructions is most appropriate for the nurse to include? A. That you can resume heavy lifting 2 weeks after surgery. B. Avoid driving for 4 to 6 weeks. C. You can return to all activities after 1 month. D. No physical activity for the first 6 months. The answer is option B. Avoid driving for 4 to 6 weeks.
Thank you for watching.